Hello, everyone. Thanks very much for joining us this afternoon for our session. It's organised with ourselves, Social Enterprise Scotland, the TSI Network and TSEF, or Third Sector Employability Forum, to give it its full name. I'm really looking forward to this session. I think it's going to be really fascinating. I'm Jayne. I'm the membership manager at Social Enterprise Scotland, and I'm on the exec group of TSEF. We've run a lot of these sessions recently, so if you've missed any, I'll post a link in the chat as to where you can find them to catch up. This is the last in the current series, but potentially more to come, I think. Let's look on the optimistic side here. And they're fairly informal, these sessions, so but if you keep your mic on mute whilst we have speakers talking, that would be really helpful. Please use the chat to say hello, to introduce yourself, say where you're from, where you're based. And if you want to post any questions as we go along as well. Just to confirm, we will share the presentations following the meeting and speaker email addresses. And talking of speakers, we have some brilliant ones here with us today and a lot to get through. So I'm just going to hand over to Pegs Bailey, who is National Third Sector Employability Partnership Engagement Manager, who's going to steer us through today's session. Thanks very much, Pegs, over to you.
Thanks, Jayne. And I'm going to hand back to you for admitting people if we've got any more latecomers. So welcome, everybody. Great to see so many folks here today to hear about human learning systems and maybe how this connects with the wonderful world of employability. The way we've structured the session today is we're going to hear a little bit from Gabriel Eichstellar, from ThemPra Social Pedagogy. They are one of the partners in the Human Learning Systems Collaborative, and he will talk us through what it is, where it's come from, and yeah, a bit more kind of like about the theory of that. And then I'm really delighted to hear we'll have Des McCart from NHS Scotland or Healthcare Improvement Scotland, depending on which logo I'm looking at, but talking about actually how human learning systems approaches have been being used to guide the work they're doing in healthcare contexts in Scotland, which is really, really fascinating. And then I'm going to come in on the back of all of that with a little bit of a background of how we use that to guide our work around No One Left Behind and employability service planning and commissioning when I was working in Fife. So that's the kind of arc. We've set it up so there's like a bit of a pause between each of the speakers this time. So so hopefully that's going to work. It's a bit of a different way of doing things. And I think that's pretty much it in terms of intro. I think it's probably best if I just hand straight on over to Gabriel to talk to us a little bit about this thing called human learning systems.
Thanks, Pac. Welcome from my side as well. It's wonderful to see you all and to get to talk about human learning systems. To start us off, I just wanted to share a little example from Gateshead, where a mom was falling behind on her council tax bill, and the usual process that the council had employed would be to, send threatening letters. And if that wasn't going to result in that mom or anybody else paying the council tax, they would send over the bailiff. But a while ago, Gateshead decided to do things slightly differently. So rather than send threatening letters and then send a bailiff that would usually not recoup any of the funds owed, they decided to actually send a community development worker. So that person met with the mom and tried to just understand what was going on for her. And as it materialized, she had recently lost her job and had fallen behind on paying her council tax. Now, the reason why she had lost her job was that she had to work shifts in the evening, and her mom had usually covered childcare for the lady's son. And because of a threatening neighbor in the social housing flat that she lived in, her mom was unable to come around. She couldn't therefore go to work herself and had lost the job. So all of that kind of started to spiral out of control, resulting in her losing her council tax, basically not being able to cover her council tax bill. Her son then also kind of fell behind at school because it took a long time for him to get to school. He was often late, he missed the bus, it was tricky to get to transport-wise, and so on and so forth. What the local authority then did, having learned more about her circumstances, was they suspended some of the systems rules that they had, which would have said that normally you can't just move into a different social housing flat once you're behind with your council tax bill, but they accommodated that. They found a place nearer to school. That meant her son could go to school on time. They managed to buy him some new school uniforms so that he was, presenting in a tidy manner. And she was able to get her job back because her mom was able to cover the childcare times when she had to be on shift. And I think it shows a little example, just a little human snapshot into the fact that people's lives are often very complex. People's lives can be quite messy, and one thing leads to another, leads to another, leads to another. And so this approach of actually looking for what might be some of the signs, some of the signals that might tell us as professionals that there's something going on that the person needs support with. That's the bit that's really important. And when we listen then to that person's story, better understanding what is going on, then we can start from that recognition that the world is messy, that the world is complex, and the more different issues kind of come together, the harder it is for somebody to untangle that on their own. So then we need to kind of recognize that we're often in this box, and we need to actually suspend our certainty and engage with people's real lives. We're often trapped in that narrative that suggests that solutions should be simple and linear, that if we have great metrics and we have rigorous management structures and we promote competition between different services, then we'll be in full control and everything will be just fine, at least as long as we stay in our little box and don't open the door. Now, human learning systems has emerged as a different approach, and an increasing number of leaders, practitioners, and academics are recognizing that really just closing the door again doesn't make things better. That we can actually embrace the fact that the world is messy and complex, and that the best chance we have to improve people's lives is by centering public services around three aspects: placing humans and relationships at the heart of public service, bringing people together to learn with and from each other so that we can better understand what a complex issue looks and feels like from different perspectives, and thirdly, creating more connected systems that fit around people rather than expect people to fit into them. And this is what's been articulated as human learning systems, developed from the inspiring and radically pragmatic work of people like those in Gateshead, lots of people across Scotland that have been at the forefront of this, and elsewhere across the UK and even beyond. You can actually find lots of examples, more than 70 examples of HLS practice from various different fields on the HLS website, which we're going to share with you. And they show that really everybody benefits when we find an approach that's much more humanizing and much more able to genuinely support people to flourish. So I'll give you a very short whistle-stop tour through the three principles: the human, the learning, the systems. And with the human, it's really recognizing that people have inherent potential, that there's a diamond in every person, and our job is to create the conditions in which people can shine, in which we can unfold that unique richness of people. And that's about, kind of, to take another metaphor, it's about gardening rather than sculpting. So it's not about creating people based on our own idea of them, but it's about creating the conditions for people to thrive and to flourish. And so we need to really focus on what is our ethics, what is our purpose here, how can we bring these values to life, how can we show that belief that we genuinely want to support people to thrive. And we need to take collective responsibility to really humanize practice and to focus on relationships. So the key question in this area is really, what does being human look like in your practice? And that's a question to really reflect on whenever we do things. It's like, what are we doing to humanize our practice to make sure we don't reduce people to case files or statistics. In terms of learning then, learning has a really critical role to play in complex situations because there is no one solution. There's no simple way forward. We gain insight and knowledge by learning together, by being on a journey together and being constantly curious, asking ourselves lots of questions. And so therefore learning is not a luxury. We can't treat it as a luxury. We need to put it at the heart of what we're doing. And we need to focus on the idea of emergent learning rather than thinking that we can learn things from guidebooks or from previous work. We need to learn through intentional and iterative experimentation and connecting different learning cycles so that the learning can kind of flow across different hierarchies in the system or across different parts of the system. And so the aim is not to just replicate what has worked before, what we've done before, but to actually increase the creative possibilities that we might have, to feel like we have more strategies at our disposal to respond to the complexity of people's lives. And so that requires the willingness to make mistakes, to see that we're going to make mistakes as part of that because we can learn from these mistakes and we can better understand what is going on, what is kind of influencing a complex situation. And so we need a positive error culture. We need to have a high level of psychological safety so that people feel encouraged to try things out and to learn from them. And so again, the question is really for us each to think about how are we nurturing learning in our own practice. And so that brings me to systems. And the idea there is that systems are critical for creating outcomes. So outcomes are the emergent propensities, the emergent properties of a system. It's actors and factors within that kind of universe that come together that create an outcome. And you can see that visualized there as a little universe. And that we need to think about systems at different levels. We need to understand that a person's life is a system in itself. There are lots of different actors, different factors that come together. We need to see our organization as a system, our team or our service. We need to see our place, our locality as a system, and work across that locality. And we need to see sort of the highest level system is in terms of our region or the country that we're working in. And ultimately, it is about how can we encourage, promote, increase the health of a system, recognizing that outcomes are very much to do with the health of the system. So the healthier the system looks, the better the outcome. So if you think of like ecosystems, for instance, the healthier an ecosystem, the better the outcome for everybody in it, right? And so that is about the quality of relationships between the relevant actors and the trust between everybody, recognizing that collectively we can achieve benefits, but we're not individually fully responsible for achieving an outcome because it's beyond our own individual control. And so that moves the focus towards system stewardship, towards the idea that we need to cultivate those relationships, help bring people together across the relevant systems and shift the accountability towards learning with each other so that we can see something complex from a range of different angles, different perspectives. And so again, the question I'd like to leave you with is really that bit about when you're working well with other actors who are important in creating outcomes, what happens? So we want to make a little bit of space at this point for any questions and reflections before we move on. So feel free to either put them in the chat or write yes in the chat if you're happy for us to come and ask you a little bit more. In the meantime, I will just take the presentation down so that we can see a few more people there. Curious about anything there, or want to have any questions answered at this point, feel free to raise your hand or come off mute or write your question in the chat.
I noticed that Maddie's popped in the chat about loving that lived expertise and peer learning is included here. And I think that's a really important part. And we'll kind of come on to and talk a bit more about that later when we talk about the No One Left Behind Fife practice. But I think it's centered in the human learning systems approach. And I think it's one of the things that's really important about it.
Yes, absolutely. And it gives us that opportunity to acknowledge that we all bring a unique perspective to a complex situation, and that we all need to listen out for what our different perspectives are. And therefore, we need to engage as learners rather than come into a situation thinking that we have all the answers. We know everything there is to know. So absolutely, the role of supporting people with lived experience, living experience, lived expertise, to kind of be part of that is really important. And that's also why it's so critical that we have a high level of psychological safety, so that people feel able to share their perspective on something. Great. Des, will I hand over to you then?
No problem. Hi everyone. I'm Des McCart, part of Healthcare Improvement Scotland, and my background working in the commissioning space with health and social care, so very much in that space of working in partnership across third and independent sector as well as public sector to try and make sure that there are those spaces that Gabriel talked about having space for people to thrive. And in particular, did a lot of work around self-directed support, which is a piece of legislation which is really aimed at that, putting people at the centre of their own care and support and being able to drive that. Can we go on to the first slide, Gabriel? Thanks. So to give you a sense of how this has kind of landed within health and social care in Scotland, and I'm sure anybody picking up newspapers every day sees plenty around health and social care. I know there's an inquiry ongoing at the moment in terms of looking at COVID. So it's an area of a lot of emotion, obviously understandably, and it's an area of some really important stuff going on. So it's something that for us looking at, so how are we managing this in complexity, has been very prescient for us before COVID, and it's become even more so. And this is just to give you a wee bit of an inkling as to what that landscape looks like, and why the kind of the HLS stuff, the human learning system stuff, spoke so loudly within health and social care, because it started off in one respect, it had those elements in there about having person-centered practice, really thinking about what matters to people, but thinking about it also at the other end in terms of system and how we use learning as the conjugate, you know, the bit that joins those things together. So you can see here, oh, sorry, can we stay on that slide? Sorry. You can see there the complexity of landscape that we're working in, which has those things about which are very clearly health and social care, self-directed support, realistic medicine, NHS Renew, which is of course and the National Care Service Bill, which is there very much more recently. But you've also got across that is things which are across all of it, so things like human rights, translated into Patient Rights, Equalities Act, but that whole set of things all driving towards change, but not all necessarily seeming lined up. So how does self-directed support align with things like procurement reform and integration and welfare reform? So sometimes pulling in what felt like different ways. So how on earth were we going to manage the change that was happening? Again, COVID was a bit of an accelerator in terms of having to look at change much more quickly and respond more quickly, but something that was a journey which was began before that, about 3 or 4 years, in terms of looking at how do we manage the changes required within the whole of the health and social care system, so that we really do deliver on that notion of human rights, about people having choice and control in their own well-being. So I can go on to the next slide. Right, thanks. So I guess we had two choices, that we had that new public management. I know that he didn't explicitly call it that. It's one of the kind of central tenets of HLS is responding to what had developed in the public sector about new public management, which is what's described there on the left. It's top down, its delivery chains, its levers, its plans, its targets, and in particular that third one, top-down targets and initiatives. That's very often where we drive our notion of improvement from, things which are set at the top of the tree by government, and they're for good reason, don't get me wrong, they are for good reason, but they're always behind the curve because they reflect what has been happening. So therefore, it's kind of the opposite of learning in that respect. There's not that openness of what's happening now, how do we understand, for example, in the current kind of prevalence of Scotland's background of drug and alcohol, what is the main drugs on the streets sort of thing. So how are we responding to that? What's happening within different aspects of well-being? When SDS come in, when realistic medicine come in, how are we understanding what's happening now and responding to that? Wasn't there. We didn't have that level of focus on learning. The learning tended to come all the way around and then come down from the top. So that evidence-based. And it's very strong and it's really useful. And in a medical place, it's actually particularly useful and it works really well. But that complex map that we showed just there a minute ago was what we were beginning to look at, saying we need something which allows us to really deal with that complexity. So what we were drawn to was what was coming through within that HLS, that strategic systems leadership, thinking differently as an enabler rather than a fixer. So recognizing multiple drivers for improvement. So it's not about linear, it's not about saying we can go from A to B at all. You can do that in terms of perhaps things like patient safety. Patient safety was already very good and you continue to improve that. That's great. But when you're in a space where it's much more about the well-being of people in terms of things like mental health, which of course was again accelerated under COVID, a lot of these things which are about well-being and about staying well in particular, not waiting until people are particularly unwell and hitting the A&E departments or hitting the front door of social care and already at high levels of need. How do we get into a place which understands what it is that drives that? So self-improving systems, I'll talk in a wee second about an example of that, about actually giving workers much more autonomy and agency, because actually those are the people who see those that are being supported. They see them day in, day out, whether they be in the public sector, third sector, independent sector. That's who is engaging with their citizens. And you saw it again in COVID, that's who was out there working with people. So self-improving is about being able to do that as close to people as possible so that it's not being driven, as it were, in a kind of a room, many miles away. And that 360-degree accountability comes through in terms like community empowerment, SDS. These were all about saying, what matters to me is at the front. What matters to people who are using those supports? That's who we've got ultimate accountability to, not to the highest level in terms of the measurements, which is where it ends up being kind of manifest and where we see it. It's really to the people that we're serving as public servants, which we are in terms of public sector, and that extends to certain independent sector who are doing those roles as well. So thinking differently about accountability and having a focus on transparency and learning within that. Saying, how are we bringing real learning into this, in the moment learning, and responding, what is it we see, what are we doing about that, and then what do we learn about making those kind of changes, needing to be much quicker and much more focused on what matters to people. So that evolving complexity and thinking around leadership. What does leadership mean? More of a distributive leadership rather than heroic leadership, something which is being able to be there and responsive and take responsibility, but also being able to allow others to take on those roles who are better placed to do it. So that was the choice that we were facing, and we're moving that direction. It's not to say that we are in a wholly different, but it was moving that direction. Could we move on to the next slide? Thanks. So just to give you very quickly, and again, Gabriel said that there's actually much written about these examples, so we can share afterwards some write-ups of these. At North Lanarkshire, we've been working with the health and social care teams there in their 6 locality teams. So thinking about the geographical areas within North Lanarkshire, places like Bells Hill, working at that local level and saying, how are they working differently? And they're using a learning-based approach to say, to work in a multidisciplinary team, but rather saying, I'm the district nurse and I do the district nurse role, and the social worker, I do the social worker role, the tech person, I do the tech role, actually coming together as a team and saying, okay, Mrs. Smith is who we're looking at just now. Mrs. Smith could do with a wee bit of this, some of that, and understanding those whole person needs. So having a good conversation, understanding the whole person, and then being able to respond as a whole team. It's like, okay, we can put this in, we can put that in, and therefore looking at it much more in the whole. So the person's experience is one conversation. and one access into a whole range of supports. And there's a number of ways in which this is happening. But the enabling hubs is at the hub of it. It's really having that notion, not a hub under one banner, but actually bringing all of those skills together, and increasingly bring third and independent sector into that as well, as they begin to get confidence in that. And it's only 6 months into that one, but already seeing huge impacts, things like waiting lists coming down enormously, because they're able to get to what matters to Mrs. Smith much quicker. Forth Valley is another example, pre-diabetes support, somewhere which is very hard when it's in that pre-space to actually get focus and attention on that. But people that were already in Forth Valley doing things like that were people, for example, in Denny, where there was a drop-in community-based support, which was around food and other supports, money advice, etc. And again, they created a multi-agency support in there, which was looking at, again, different Mrs. Smith, obviously, and I'm not very inventive in my names, apologies. But when somebody's coming in that front door, that again, they see the whole person, what they're interested in is looking at that pre-diabetes. It's one of the, unfortunately, league tables that, again, Scotland is quite high up on in terms of being in diabetes and pre-diabetes. They're seeing increasing, and it has very life-limiting effects. So it's something there's a lot of focus on. But if you wait until they're hitting the front doors of hospitals and actually into that diabetic, type 2 diabetic space, you've already lost a lot of ground. So being in the space where you understand how are people looking at it in terms of their diet, etc., and what they've found, again, are people being able to get to support much quicker because they're understanding the need as a whole person and understanding how it manifests for them. So how it works with their family, how it works with their employment, etc. Not just seeing the pre-diabetes, but actually looking at the whole person. And that's very different for the nurses who've been in that space, being able to look at whole person and not just deal with the pre-diabetes, but recognizing they've got money problems, they've got all these other issues around. So really get to whole person. And again, so that appeared in the Chief Medical Officer's report of last year, because it was a good example of really good service and centre practice, and at the heart was that learning-based approach. And the last one, self-directed support, self-evaluation tool, that thing about self-evaluation, that's putting in the hands of teams who are making self-directed support happen in the Highlands, across the whole area, is what is it that's working, what's not working. So rather than being evaluated and almost that kind of pass-fail kind of way by somebody else, they were self-evaluated to understand what's working, what's not. And the accountability comes because it's very public and very obvious to the citizens and the people of Highland who will be saying that's working or it's not. So it's not a kind of ticking it and marking your own homework. It's having those conversations with the people they're supporting, saying what works here. When we do this, does that work? When we do that, does that not work? And so having that self-evaluation, because what it does is it gives them an improvement plan rather than somebody else saying, you're doing this wrong, you're doing that wrong, you should do these things. They're actually understanding it, they've got agency, and they've got the ability to make the difference of saying, well, actually, we're doing this thing. It's a wee bit kind of under the radar, but it really works. Okay, what works about it? Bring it above the radar and make that the way we do things. Could we go on to the next slide? So what we're doing just now is taking this whole system approach and bringing multiple methods. So we've got things like QI, quality improvement, which is in the health space. We've got things like service design, which sits across a number of areas. We've got things like strategic planning, which sits within health and social care. There's a whole lot of methodologies and theories. And what we're doing is at the moment bring them together in the Scottish approach to change, which is what we're developing just now. And it brings that HLS thing into it, saying, putting a learning-based approach, putting a learning system at the heart of our quality management system with across the whole health and social care system in a very practical way. Some of those examples I just gave there in really practical sense. So the theory you can get lost in, the application of that at local level, what works, how does it work, and how do we then do change driven from that? Could we move on to the last one? So this, we don't want to kind of scare anybody, but this is our current thinking on it. There's a web page where people can link into, but you can see how what we've got there is that when you're in a fairly stable state, when things are working reasonably well, you're in that kind of horizon one, then you've got a quality management system. You can see it there. This is what we already operate to within health and social care. Learning system at the centre, clear vision and purpose, leadership and culture. But you'll see words you recognise very strongly there about relationships, co-design, co-production. They just stay buzzwords, they're not very helpful, but when you're really in the space of empowered individuals responding to what matters and being able to then change your system based on that, so it informs your policy, it informs the way your system works, rather than trying to just steer individuals through a system that's not working for them. And you want to get to that at the very end as well. You want that to be your kind of horizon 3. The bit in the middle is what we're working on. How do we manage that level of change? When you remember that first slide that showed you about that level of complexity we're trying to work our way through. So we've got partnerships right now in health and social care health boards and health and social care partnerships saying, how are we going to manage through this complex environment of really putting people first at a time where money is reduced, at a time where we've got things like how we're looking after our environment. So we can't just keep doing that kind of having 1 million people visiting 1 million people. We need to think differently about how we're doing it and look at the whole system. And that's what we're looking at at the moment, is keeping that learning system from that HLS idea right in the heart of it to inform as we go through change, that kind of step change about develop and design it, prototype it, test it, but getting to that, and you can see at the bottom of those essential elements is that we've got person-centered approach and learning are right at the front of that, and leadership. That is very whistle-stop, and apologies if that was a tad fast. It is recorded, so you'll get to go back and look, but there is a lot of material again that we can send out links if people want to have a little bit more time to look at those things. But just to say that that's where health and social care in Scotland is going at the moment in these challenging times. Any questions there?
I see Jenny's hand up there.
Thank you. I suppose it's a bit of a reflection. Thinking back to the description of the different facts, different parts of HLS and systems operating at different scales. My ears pricked up when you talked about SDS there, Des, because that's something that as an organisation we're really heavily involved in. And the theory is amazing, but I wonder whether there is a danger that we're setting people up by saying, you know, we're going to learn the SDS self-evaluation, let's hear about what's going wrong, when there's actually no facility to change what's going wrong. That it's quite often down to funding. It's a much bigger problem than a few people feeding back saying SDS has gone wrong. So I suppose it's a reflection on the theory is great, and I'm sure in lots of ways it works brilliantly, but I think there's some dangers there.
I think that's a fair comment, is like that none of this is magic silver bullet stuff. I think if you have a look at the Highland material, we'll get that sent around, because what it really comes down to is very much at those local levels having honest conversations. And I think it's interesting because obviously in Highland it's easier to see because you've got distinct rural communities, and you then look at that as whole system there and how they are operating as kind of circular economies and all of that. You're looking at in Glasgow, that becomes a wee bit harder because the notion in Glasgow is that you can get something by economy of scale, and that's how health and social care has been derived. Care at home care being the obvious one, but actually some of the lessons from rural, I think, is be interesting how that's adapted into somewhere like Glasgow and saying, actually, communities exist in Glasgow, street by street, maybe 2 or 3. And if you look at some of those, then the sustainability comes from, and it isn't magic bullets, but it is an honest conversation about what is possible and what's not, and taking away some of those rules which are getting in the way in terms of people feeling constricted by them. And some of that is what's come through. The Highland one's a really good example, and it's I'm trying to remember the name of the conversation, in Control Scotland, Pauline Lunn, who you may know, who did that piece of work. So have a chat with Pauline. I think she would love to have a chat and to think about how might this work in Glasgow. But you're right, it doesn't fix everything by any means, but it's a more honest space, I think.
Okay, thank you. Yeah, that makes sense. Thanks.
Thanks, Des. Anyone else? Any other reflections or questions on that input? I've also popped the link to the Scottish approach to change in the chat, because I think that is very much the way it's kind of being described as a developmental piece. So feedback is valued and appreciated as well. So, you know, I think that's kind of useful. So don't do it now. Stay focused because it's me next. But but do afterwards take time to go and have a look at that. I think it's really worthwhile. And I think it's really helpful to see that learning mentality being presented in a strategic kind of large scale public sector context. I would also say, as Des has said, this is a work in progress, and I think all of us will recognise that there are some contexts in which this happens more easily than others, and so it's all a direction of travel, which is in itself a human learning system mentality, I suppose. So before I start giving a presentation on No One Left Behind, I actually want to share a short clip. It's a 4-minute video. The music on it is absolutely terrible, so we've turned it right down. But it kind of summarizes everything that's been said so far. And for me, although it's talking about homelessness, it really equates to some of the challenges that I experience in the world of employability. And I'm sure that those of you that work in that field will do too. So yeah, if you can press play, that's great. Thanks. Brilliant. Thanks, Gabriel. So I could see a few heads nodding there while that clip was showing, and a few people kind of, yeah, that seems to resonate. For me, it just felt so familiar when we think about employability and the purpose of No One Left Behind, and the learning that we had in Fife around that, which I'll talk about in a minute. You know, that targets around job outcomes are so easy to measure, and they are super important. It is about getting people into work. But if we only focus on that and we use that as our pure measure of success, then we miss a whole load of other really important information and learning about what is and isn't happening. So I'm going to give you a little bit of a brief overview of how we kind of took that kind of mindset into the work we did in Fife when we first got funding, or the Scottish Government first shifted to the sort of locally relevant, person-centered approach to employability that is No One Left Behind. This case study can be read on the Human Learning Systems website. So when you get these slides, that's a hyperlink. So if we go to the next slide. So at the time when, you know, my previous job before this one, I was working at Fife at the Third Sector Interface, and I was the Third Sector rep on the Local Employability Partnership. And we had just done a whole piece of work around co-production in mental health and employability and understanding what was working there. And that kind of mindset really flowed into informing how we wanted to take No One Left Behind forward in the area. And a couple of things that really kind of leapt out to us around that was this idea that this should be a continuous improvement mindset, that was what No One Left Behind was about, that we should never be at a point where we think, oh yeah, we've all got this sorted, and that it should be driven by evidence, including data and the experience of users. And then I suppose I haven't circled it, but also this idea that it should be about flexible and person-centered support, not about what the services said they could offer. So how do we take that forward? Well, if we go on to the next slide, we took two methodologies. We'd already got people's heads into this concept of service design and co-production on the back of the work we've done around mental health and employability. So we did not, in fact, I did tentatively try and bring the concept of human learning systems into a LEP meeting. And to be honest, it kind of freaked people out. So I just kind of kept that in the back of my head as we went forward on the journey. So we spoke a lot about service design, which obviously is centered in a lot of the No One Left Behind work. And in service design, you spend as much time understanding the problem as you do thinking about the solution. And the other thing that kind of came into that work, next slide, was that we wanted to do that in a co-produced way. So we really, really wanted to make sure that when we were understanding the problem, we could understand what that looked like from as many different perspectives as possible, because we felt that was going to get us better insight into what the solutions might be that we needed to have in place. So if we go on to the next slide. So this is kind of our journey captured under the human learning and systems headers. So the first thing, I suppose, in terms of the human part of what we were doing is we wanted to make sure that we had a real diversity of perspectives on our planning group from the start. So pretty much, I think by the second meeting, we had local authority, third sector providers, DWP, and people who were using services in the planning group. And that really helped shape and ground us in how we approach the rest of the work. And that kind of group, it changed over time. You know, we did this all through COVID, so some people left, some people joined, but fundamentally that premise, it was a group of about 20 by the end, was kind of absolutely central to the work that we did. And we also tried to take kind of an appreciative inquiry approach, rather than what's wrong with them over there, actually what's worked in your experience of your journey to work, or what's worked in your experience of receiving support, and how might that help us inform how we want to do this work when it comes to employability in Fife. And I'll talk about what we learned in a moment, but I suppose that's just an important concept. So we didn't have separate questions for providers and people who are using services. It was the same set of questions for everyone. And it was really much around this kind of what works idea. We wanted to focus on people's personal experience rather than this kind of what they need, and this is the, you know, how the system works out there. And also from a human perspective, we wanted to make sure we really reached those humans that are quite often less heard less involved in these conversations, and who we knew we were missing, or we were maybe not serving so well from our own data. So for example, people from the LGBTQ+ community, people from ethnic minority backgrounds, people who had experience with the criminal justice system. So kind of really focused work there. And we worked with trusted partner organizations to do that, and went to the spaces virtually where those people were, rather than asking them to come to us. I think the other thing which I've missed from this slide, but I think is really important in the human element of what we did, was those personal values and personal thinking about how we show up. How I showed up as the facilitator of that journey, but how we work together as a steering group as well. The importance of respecting different people's experiences, that we had a kind of ne-Hygiegens approach, so everybody was equal. Listening, being aware of our judgments, kind of holding those back and applying filters of good intent. So we did quite a lot of work around what it is to show up as a human, as ourselves, in these spaces, as well as thinking about how we delivered the engagement work in a human way. When it came to learning, I would say this was probably the piece that we centered, you know, I, with hindsight, maybe could have done more on. So first of all, though, we had shared learning for us as a steering group. So we ran facilitated training for us all. We learned together. We also, the whole process was a learning journey, because it was a kind of very big engagement. We ran, I think, in total 15 engagements online, 9 with targeted communities, 7 with different geographies. And we also ran a massive online survey. So the survey had reached 120 people, and the online engagements reached around 122 people. So it was a very big piece of work. And before and after each of the online engagements, we would have reflection time for the steering group, for the facilitators. And we tried to make sure that in each event we had a mixture of somebody who was a professional and somebody who had lived experience hosting those things. We had this continuous improvement mindset and this kind of curiosity thinking. And then in terms of the systems that we put in place to try and kind of help that, we did things, usual kind of stuff, like we had stakeholder analysis to make sure that we knew who we needed to reach and where we were reaching them. The system of the multi-perspectival planning team was critical and foundational. We aimed to run collaborative conversations where you bring everybody together, but to be honest, with the online world and lockdown, that didn't work as well as we had hoped. But we did do intensive equalities monitoring of all of our engagements to try and make sure that we knew we were reaching who we were and weren't reaching, and then do a bit of extra work if we felt we needed it. And we had the online meetings and the survey, which supported all of that. So those were some of the things that we did. And what we learned is we went from thinking about employability as something which is like a clock, you know, you input your CV and your interview skills and a bit of work experience and a job interview, and you get an employed person, to something which is a bit more like this, a bit more like a cat. So if you take a cat apart, as my colleague said, you are a bit of a psychopath, but also you would have no idea how a cat works. It is a complex being that is continually changing in relation to its external and internal environments. And therefore, you work very, very differently if you're thinking you're working with a clock or if you're thinking you're working with a cat. So if we go to the next slide, what that meant was we started thinking about employability as a complex concept, a complex, unique, and always and ever changing concept, which was affected by what was going on for the individuals who were accessing the services, but also stigma in the workplace, public transport, healthcare, the availability of jobs, a whole host of other things which were completely out with their control, but also quite often out with our control. And as soon as we understood that, we realized that we couldn't really keep commissioning services on the same kind of inputs equals outputs approach that we had done previously. The other thing we learned was that actually, because of that, how services were delivered was absolutely as important as what they did. People needed to come out of those experiences feeling heard, valued, not feeling judged, things like discretion, support, strength-based conversations, rather than sort of the fixing mindset that sometimes, very well-meaningly, people can experience when they're kind of accessing services. So we really flipped what we thought mattered. In terms of what that then looked like, this is a kind of before and after. So, you know, before, services were delivered based on what they offer. Staff were trained in whatever the provider invested in. Afterwards, we actually really encourage services to embed reflective practice in their own frontline and supervisory structures, because everybody's journey is unique. And we actually invested as a partnership in solution-focused and strength-based training, as well as more collaborative approaches to training and things like understanding equalities. When it came to commissioning, we moved from the kind of focus on numbers and targets to something which was much more valuing of the qualitative elements of what was being delivered, the quality and approach, the sense of collaborative approaches, and also we created a lived experience panel to support assessment of applications and so on, help guide that work. And then finally, and this is all still a work in progress, the governance and oversight shifted from one which was much more just about, you know, how are we doing on the numbers? Tick, we've got the numbers, everything's fine, or no, we haven't got the numbers, right, stop funding them, to something which was much more dialogic, much more collaborative, much more focused on learning. And if there were problems with delivery, understanding what was happening behind that before making a decision, or if things were doing very well, what's happening behind that and what can we learn together. It is not all solved, but we're working on it. Oh yes, so I'm running out of time. So it doesn't have to be HLS to have an HLS attitude. Get the right balance of people in the room. Values matter more than structure, systems and tools. And finally, the work is never done. So I think that's it from me. Oh yeah, I'm not going to go through them. You can read them by yourselves. I want to make sure we've got a little bit of time for feedback, questions, reflections. So yeah, you can take the slides down, I think, Gabriel. Yeah, just interested to hear, that was a whistle stop, but any questions, any reflections? Does any of that chime or resonate, or is there anything you think would be problematic about trying to bring that to life where you are? Have I stunned you all into silence? I think there's also to say there is no such thing as a daft lassie or laddie question in my world. So that was part of our ground rules.
Hi, sorry, I was struggling to access buttons to put my hand up. And there's an interesting point raised in the chat by Mandy, is that, I'll be honest, I feel the same, that a lot of this, it's fantastic. I mean, I set up Lex Scotland specifically to support and develop these sort of lived experience centered approaches. But I always end up coming away with this feeling of, yeah, we've had these ideas, we've done this learning. You know, for me, it wasn't homelessness I started out in, but it was member-led community mental health services. And we were talking about all of this then. We were talking about having these integrated approaches to our service users back in the 90s, that, you know, their mental health issues weren't just a clinical mental health problem, they were about homelessness, they were about employment. And what I haven't seen is any real major change to how, particularly funding, I think, funding and commissioning really actually works on the ground.
Yeah.
If anything, I've seen a narrowing. The service I used to run back in the late 90s was a 5-day-a-week drop-in service. This was back in England, so, you know, can't blame up here for that. But you know, we offered that wide variety of support, and we were closed down.
Yeah.
And now it's possible to set up a similar service under the current commissioning and funding environment.
Yeah, so Gabriel actually shared a really depressing quote with me the other day, which was, now I'm going to get this right, Gabriel. So it takes a little longer for a person to change the system than it takes the system to change the person. And you know, and I feel a bit like that with this, because if you look at this, a lot of this work most recently comes from the Christie Commission, which was 2011. And he also in that said radical change is very, I can't remember the exact quote, but it's very, very difficult. So I totally hear that frustration, and I guess that's why for me, I'm really keen that we get this out as far and wide as possible. I think the one thing that I like about the human learning systems model, which you know is, and it's really helpful that Healthcare Improvement Scotland are kind of trying to take on this mindset as well, is that it does create a framing which gives a certain amount of certainty or security to policy and decision makers to try and start working in a slightly different way, kind of because it talks about the governance stuff, but it is still butting up against and trying to happen in a system which continually pulls us back, I think, to target-based delivery, target-based discussions. And as you say, the funding models certainly in some areas are moving towards supporting this, but in other areas they are still happening in kind of patterns and pushing patterns of behavior which are really outdated and unhelpful. Gabriel.
Yeah, I think on the funding side, there are some really good examples of how HLS can actually work in funding and commissioning in particular, because I think funders and commissioners are recognizing that very often we're playing a game where we're just kind of setting targets and KPIs that somebody else then proves they're meeting, and actually we're spending a lot of money, a lot of resources on not really making life better for anyone. We're just trapped in this game. And I think human learning systems has the real potential to kind of get us out of that, as Des was saying, like to recognize what the real world looks like is much more complex. And so let's just stop playing that game of charades of like, I'm responsible for the outcomes of my service and I take all the credit for what we've achieved and I've got all the stats to back it up, when everybody knows that that's not my achievement, and nor have things changed in the way that I might claim to. But otherwise I won't get the funding. That doesn't serve anybody, and I think funders are really increasingly starting to understand that as well. Wendy, can we just bring you in there as well?
Thanks very much, Gabriel. Yeah, we're doing some really interesting work in South Lanarkshire. I'm involved I'm in the TSI in Vaslan, and we're working collaboratively with the community planning partners to kind of do a review of the relationship with the third sector, and also looking at systems through the Marmot initiative, Marmot Places lens, because South Lanarkshire has just become a Marmot Places place. Sorry, there's a bit of noise in the office. My question is around about winning people over, or taking people with you on this approach, because I think it's what we're talking about as well here. Some people will be very much convinced, as I think many of us are here today, by the human learning systems approach and how and why that will work. Other people need to see the financial reasoning behind it, so that kind of return on investment to really nail that this works. Because, and the video you showed, Pegs, indicated that, you know, it was the little schematic where the chat was saying, you know, you've got this nice package of support, it's going to end up being cheaper in the long term. Do we have any evidence around, can you share some evidence that we could potentially be using and saying this is a great approach, and actually here's some financials that show it's cheaper?
Yeah, Gabriel, you go. And if you need to duck off, aware we're at time, please do. If those can stay on, we'll run over for another couple of minutes.
Yes, there's definitely evidence that is a lot cheaper, and some of the bigger local authorities have, you know, run the numbers and are investing into human learning systems because, not least, because it's also cheaper. So yeah, we can share all of that.
That's great. I'm aware of time. Jayne has popped the link to the evaluation for the session in the chat, so please do take a little minute, either now or later, to give us feedback, because we do listen and it's useful. And we will get the links that are in the chat and they'll get shared with you. Jayne, is there any other bits of housekeeping? Storytelling workshop, do we need to share about that for our third sector colleagues?
Oh, yes. So we have basically what comes back to us when we run sessions is that the sector needs to get better at telling its story and kind of evidencing its impact through that. So we are, in partnership with Social Stories Club, running a kind of storytelling workshop. It would be 3 hours, but 3 very valuable hours of your time. I'll follow up in the email with the link because I don't have it quickly to hand. There is a cost, it's £35. It's £35 very well spent, I think. Karis, who runs the workshop, is fantastic. But I think that's it. I mean, if you can take a couple of minutes just to fill in the survey, that would be really appreciated. And thanks to you for coming along. Thanks to our speakers for taking what is obviously very complex, and framing it in a way that I think even this daft lassie here can understand. So thanks everybody, and we'll see you all soon.
Thank you very much, everyone.